So welcome to today's talk, where we're going to be interviewing a couple of entrepreneurs who are also NHS clinicians about why they set up their businesses and what they hope to achieve with them. My name's Dr. Imang Patel, and I'm the Chief Clinical Information Officer at Microsoft, as well as a paediatrician at Frimley Park. Firstly, let me introduce Fazana and Harris. Fazana, you first.
Hi, Umang. So I'm Farzana Rahman. I'm a radiologist by background. Used to be a consultant radiologist at UCLH, but I'm now the CEO and co-founder of Hexarad.
Brilliant. And Harris.
Amazing. Hi, everyone. I'm Harry Schwabe. I'm founder and CEO of Newton's Tree. And by background, I'm a consultant clinical scientist in the NHS.
Brilliant. I was so excited to be invited to talk to you both, because anybody brave enough to be a clinician and then jump out, and I say brave in spite of saying completely insane, to jump out and become a founder and an entrepreneur. It'd be good to know a little bit about what you both are up to with your respective businesses. And then I'm really, really keen to get out of you why you did it, what really inspired you to make that leap. Should we start with you, Fazana?
Yeah, sure. So I set up Hexarad with 3 other colleagues who are also radiologists. And the problem that we solve is there are too many scans, so CTs and MRIs, and there aren't enough radiologists, so doctors who can report them. And those delays lead to patient diagnosis. So delays in patient diagnosis. So I met my co-founders when we were registrars at St George's Hospital in London, and we could see that this was a huge problem, and we were young and naive, and we thought we could fix it. So kind of years later, that's what Hexarad now is. So we're a radiology platform, and we solve that really important problem in 2 ways. We have ReportRad, so that's tech-enabled teleradiology, and we have a software product called OptiRad. So we go to hospitals and we have for them more than one way that they can solve the problem. Software to make the most of the resources they do have, and when they're maxed out of that, then they can use our teleradiology service.
Brilliant. And so I love the strapline for Hexarad, which is without diagnosis. You can't start treatment. And I love the idea of speeding that up. I'm going to come back to you in a minute about, why you set that up. Like, what was it? I'd love to hear more about that when you were sat around in the canteen or the staff room thinking, man, what can we do from here? But Harris, tell me more about Newton's Tree, if that's right.
Yeah, I mean, it's not a million miles away. It all started with trying to do better inside the NHS. So I was working at Guy's and Thomas's, and back then I worked in imaging, and my job as a medical physicist, part of that job was developing software to improve, service delivery, patient outcomes. And I developed an algorithm in pediatric health, so pediatric imaging, and I had no way of integrating it into the clinical workflow. The way it would work was one of these babies would be born. I developed this algorithm that would do the prognosis for hypoxic ischemic infants, and I would get an email, dear Harris, such and such babies been born, can you come collect the data? And I would walk with a USB stick from my desk at Tommy's to the Evelina Children's Hospital, which is right next door, but it's still a bit of a walk. And I would go there, stick it in the scanner, download the data, walk back to my laptop. This is me sort of just as a grad physicist. And I was like, there's got to be a smarter way of doing this. And so I built a little server with sort of the tiny bit of Python knowledge I had that basically automated this. And what was really cool for those patients, so the average time to get to a result for these babies was about 24 hours from after they'd been scanned. Because I didn't work, I worked Monday to Friday, 9 to 5. So if the baby was born on a Friday afternoon, we wouldn't know the result until sort of Monday or Tuesday. But with this automation, the time to result went down to 30 seconds, and it was 24/7, 365. And what I realized I had built was something that was generally useful. It's how do you embed algorithms, AI technology within a clinical workflow? And that's how Newton's Tree was born.
Brilliant. We first met when you were at Guy's, and Newton's Tree's, how old is Newton's Tree now? It's still new, right?
Yeah, it's still new. Yeah, so it's only a year old. But yeah, that initial sort of spark was in 2017.
Wow. Okay.
Yeah.
And what made you make the jump? What was that bit? You were just sat there thinking, look, I mean, something that could take 72 hours could take only 30 seconds. Was it that made you think, right, if no one does this, it's,
Yeah, well, I mean, so it started then and it grew, right? People started hearing about, Harris's little server, and they were like, oh, can I deploy my software or not? Can I do this? And I was like, okay. And it ended up becoming sort of my job. And we got lots of research grants. We started collaborating with universities. And so the scope did grow from where it started, but it just got to a point where I was like, what became clear was that this needs to be in every hospital in the world. And at some point, you can't operate this from the basement of an NHS hospital. And that's ultimately what drove the leap into creating the industry.
Okay, great, cool. We'll come back to why it's so hard to do it from the basement of any hospital from somewhere. But Prasanna, go on for you. So I imagine you sat there with Jay, Amy, Sam, sat around thinking, right, okay, we just can't keep doing this for the rest of our careers. Tell me a bit more about that conversation.
Yeah, so we were all registrars. So we were registrars at St George's Hospital in London, which is a massive trauma centre. So what that means when you're a radiology registrar on call is you can never sleep at night. And there are 2 registrars who are on at any one time. So that we would be on call in various iterations, like me and Sam or me and Jay. And we would just talk about the problems that we saw. And it got to a point where it didn't matter how hard we saw our colleagues working. It didn't matter how many radiologists you had. It was just this almost insurmountable amount of work, and the waiting list just kept growing and growing. And I had a personal experience with the father of a really good friend of mine, who he had had treatment for cancer, and he'd had a scan for follow-up, and he was convinced the cancer had come back, but he didn't get a result. And my friend, who's actually a GP, told him that, well, no news is good news, so that's probably why. And he was correct. His cancer had come back, but there was a 3-month delay to getting that result. And so we could see just how huge this problem was. And this was, nearly a decade ago now. And we could see that the problem was only going to get worse. So we wanted to solve the problem in an impactful way. And we knew that technology was really important, but this was kind of 2014. Everyone was talking about big data. That was the buzzword then. And we knew that was important, but we also knew that what was really important was people. And, if you've worked in a clinical setting like the 3 of us have, you just know that great healthcare is about great people. It's about teams. And we wanted to kind of bring those elements together. So great people, great tech. And that's how we really started Hexarad, which was, can we streamline the good things we're seeing now? Radiology is one of those things that, as Harris said, it's actually what can take half an hour should sometimes take seconds. And so much of that's about technology. So we brought that all together to form Hexarad.
Brilliant. And then, really exciting thing when I heard you were partnering up. So it's one thing to start your own company. It's another thing to try and take on and have grand ambitions to try and improve care for not just, the people you're seeing when it's your own hospital, but beyond, potentially beyond the NHS as well. So why do you think, tell us a little bit about what brought you together. Harris, I'll start with you, thinking together Hexarad and Newton's Tree could offer something unique and really, really impactful. And then Prasanna, I'll let you tell us a bit more about the actual partnership, if that's right.
Yeah, I mean, at its base, the foundation of it is that we just have a common mission and common values. And obviously from our career backgrounds have a common history. And that's really where the partnership developed, is because we understood each other and what we were each trying to achieve in our respective businesses. And then we started talking about sort of our own ideas of the future. And that's when it became obvious that a partnership was inevitable.
Got it. And we'll go on. What is that partnership? I think now we're all gagging to know what is it that you're bringing out? Go on, tell everyone.
So this partnership is I think it's a groundbreaking collaboration. And the reason why it's groundbreaking is it combines the products that we have. So ReportRad and OptiRad. So that's tech-enabled teleradiology and software. So service and software together with Newton's Tree's vendor-neutral AI platform. And so that gives hospitals the chance to have one integration and a multitude of tools to solve the problems that they're facing. And we think this is going to absolutely revolutionise radiology.
Brilliant. And so tell me, for an overstretched clinician sat there thinking, I'm never going to cope with this, what do you think this partnership could mean to them?
I think it makes it easy for them to innovate. So one integration, so one touch point with your IT department who are already invariably resource constrained. And from that point, if you've got a big backlog of patients that need scans reporting, you can optimize your department with OptiRad, make the best use of the resources that you do have. You can use our teleradiology service, so you can get scans that are urgent reported. And then you can really think about innovation. So you can go onto the Newton's Tree platform and you can think, which problems am I facing? Which AI tools should I use? And that gives you access to all of them. And then you can measure it, which is what we all do as clinicians. So you can go and you can see which one is most effective. And by having that three-pronged approach where we're thinking service, we're thinking software, and we're thinking AI, we can truly actually solve this quite meaty and difficult problem.
Brilliant. And Harris, so you were sat there thinking, right, we're creating Newton's Tree, and you were looking around thinking, who could we partner with?
Yeah.
What brought you to Hexarad?
So the thing that made it clear that Hexarad was going to be the partner for Newton's Tree is the shared history and the shared values that the two companies have, and also the complementary approach we have to solving the problem around optimizing radiology departments. We're sort of in the business ultimately of doing the heavy lifting. Right. And so as a clinician or a service manager trying to run an NHS department or contribute to patient care, you want to be free to practice as a clinician and to innovate and optimize and not have to be lumbered by bureaucracy, IT, integration, all these sorts of challenges. And from that perspective, we see eye to eye. And so the partnership was natural.
Give me an example that's non-healthcare related that would make it easy for me to understand, and you share that with the audience.
So, I mean, it's just like, you have a traditional TV and you want access to all these applications. You heard of Netflix, you've heard of these games, but you've still got your TV from a few years ago. The fantastic things with the Fire Stick or any smart TV stick is you can stick that into the side of a traditional TV and suddenly you have access to all those 21st century modern applications, right? And you can watch Netflix or any other subscription service that you want. And that's what we can provide to hospitals, is that it doesn't require, building a brand new hospital in the desert somewhere, but actually our institutions in the NHS can become tech-enabled, AI-driven, just with a small investment.
All of us have backgrounds in the NHS, and from that background, it's brilliant that we've been able to see partnerships and grow companies and tackle big problems. What is it about that experience that brought you together, do you think? Harris, let's start with you.
Well, I think, most people who come to the NHS from the outside and try their best to innovate, what they're faced with is a very complicated, nuanced problem. Healthcare and in the NHS and just in general is a very nuanced art. And in order to innovate, change, modify, you have to have a deep understanding of all the intricacies. And it inherits it from medicine itself. The human body is a complicated, delicate, intricate thing. And the system that we've built around it is the same. And so you can't go in there with sort of a bulldozer and say, we're just going to slap this technology on top or inside this service and it's going to help you. And that's really helped me, right, in understanding how to come up with Newton's Tree and the nuances around the technology design and how we deliver it. And then in talking to Fazana and the rest of the team at Hexarad, it's very clear that they come from that same heritage. And so that's what makes the partnership so productive, hopefully going into the future, is because we have that shared understanding and that deep knowledge of those nuances.
And Fazana, I know at Hexarad you spent a lot of time talking about culture. Is that something that you find that was spawned out of being in the NHS from the beginning and something that you see from this partnership too?
Yeah, absolutely. I think it's about shared values. So, in corporate speak, people talk about values all the time, don't they? But I think within the NHS, those values are truly lived. It's why if you're a junior doctor and your colleague doesn't turn up for a shift, you just carry on working because you know that at the heart, patients absolutely always take priority. And I think that's what we recognized in each other, is that we had these shared values. Harris's early foundation of Newton's Tree was trying to help newborn babies get diagnosed with a really severe illness. For us, it was about helping patients get their diagnosis. And so I think having those shared values of really always putting patients first and understanding that if we want to build a scalable, sustainable system, we need to embed that ethos and pair it with innovation is what brought us together.
A bit more actually on the partnership then, because there's also something about this partnership that will hopefully help us address some of those issues? Because of course people are worried about using technology when it comes to healthcare, and of course evaluation is key. So from the partnership, a little bit more on perhaps how you think you'll be able to dig a layer deeper. Harris?
Yeah, I can talk a bit about that. So one of the other roles I have is I'm a clinical academic. So I'm chief investigator of a national trial involving the evaluation of AI technology. So I've tried to measure the safety and effectiveness of AI technology and imaging at a national level, and it's hard. It's expensive as well. It's very difficult to collect data. Like radiology has been digital for a long time, but a lot of radiologists' work impacts the rest of the hospital and works with or interoperates with other specialties and who don't have the privileges of having digital data. And so when you're trying to understand outcomes and impact of technology, it's really hard. And like I said at the beginning, the thing that we will hopefully be able to enable is providing the ecosystem the ability to rapidly and much more accurately evaluate the impact of AI technology, because the whole system is kind of sort of stuck at this sort of precipice. There's hundreds of market approved AI technologies that the MHRA and other regulatory bodies have said these are safe to use. And there's no shortage of AI startups pumping out new technology. And obviously, there's a real demand from the healthcare system. The thing that needs to unlock it is evidence that can populate a business case, that can provide assurance and confidence to adopt these things at scale. And nothing like this kind of partnership, I don't think, has existed.
Brilliant. And I think it is that thing, isn't it? So it's so hard when you're a startup to think, right, well, anybody that I'm trying to get service, where do I go? So I can go to one place. And then it's one thing, you go, great, I know where to go. And I've got no idea how to prove the long-term value of it. So I think being able to do that's great. There's also something else that's quite unique about your partnership, Sandra, about the services that you deliver. There's something that I've not seen before where you've been able with Hexarad to deliver services as well as technology, as well as evaluation. Do you think there's anybody else anywhere on the planet that you've seen that can do that sort of thing?
Probably I'd say the closest Amazon. So, and pros and cons of Amazon, but I think one of the things they do really well is they just understand the exact problem that their customers have because they've got deep insight. So they know that people are time pressed. They know that they need a variety of solutions. They know that the problems are interlinked. And I think in that way we're, similar, maybe slightly different values to Amazon, hopefully, but we know the problems we've been there, we've been on the front line. We know exactly how difficult it is for someone who's trying to run a department and getting emails about their backlogs and a bunch of staff who are away and poor staff morale. And then they have to fill in an innovation grant and they're being told to bring in AI. These aren't things that you can do in silo, and they're also expected to really prioritize patient care. So I think for me, that would be the natural comparison. About you?
Yeah, no, exactly. And I mean, ultimately, healthcare is a team sport. One of the things that Amazon does really well, it gives you a really nice integrated experience through all those different businesses. And that's not the experience that healthcare system has typically gotten from its vendors. And I think hopefully through this partnership, we'll be able to bring some of that magic.
So why is Hexarad unique? How come you're winning so much work across the NHS and beyond?
I think it's because we solve the problem in more than one way. So, and that is truly unique in radiology. So we offer both a tech-enabled service, so that's teleradiology, and we call that product OptiRad. And we also offer software to help radiology departments become more efficient. So when our customers come to us with this problem of just big backlogs, too many scans, not enough radiologists, our solution isn't just, well, outsourcing. It's, why don't you use our tool, use your own resources better, because all healthcare systems are under strain. And then once you've absolutely optimized your own resources, then you can use teleradiology. So I think combining that service together with software to help a customer solve a problem in more than one way is what makes us very different.
Yeah, and I think it can only be done in partnership, right? Like
Yeah.
you can't sort of mark your own homework and then sort of just assume that everyone will take that for read. You've got to have a degree of being able to partner up and show that willing. Like, whatever the adage is, it definitely takes an army or a village. Actually, on that, so earlier we were talking about, so we've talked a lot about radiology, but this isn't just about radiology, is it? There's potential for this to go beyond that specialty. Fazana, is that what you're thinking?
Yeah, exactly. I think the key is having that one integration, and then letting clinicians decide, and then being able to see real world evidence. So kind of coming back to Harris's point that it's all well and good when you see data in, you know, a very controlled setting, but you need to see the data when someone is being called and there are, you know, a million things going on. And so I think exactly as, you know, Harris has said, we can take this partnership and we can take all those elements. And once we've looked at radiology, we can certainly look at the rest of the hospital. And I think that's really important because hospital decision makers have to balance all of these different pathways. As a patient, you know, you don't really distinguish between your outpatient versus your scan. It's one long pathway, isn't it? And so I think we need to look at innovation and try to do it across the whole pathway.
Of course. Was that part of the reason you guys came up with the Hexarad Thought Leadership Institute?
Yeah, exactly. So one of the things that we realized when we were, you know, back when we were junior doctors is there's a lot of conversation that just happens on the shop floor. So maybe like in the doctor's mess, or maybe when you're standing around at a nurse's station and you're talking about, wouldn't it be great if? And so many brilliant ideas come from those people because they understand the nuances. And we found, even once we founded Hexarad, when we would meet up with friends and colleagues, you know, it's that annoying thing, isn't it, when clinicians or healthcare workers meet up, they just sit there in a corner and just talk about healthcare. And we wanted to create a forum where people could actually have those conversations and we could facilitate that. So that's why we set up the Thought Leadership Institute. It's not just about radiology. It really is about looking at the healthcare system as a whole and having the people who understand the problems really well, giving them a forum to actually talk about them and come up with solutions.
I think there's going to be like 50% of people watching this or listening to it will be going, oh my God, that is amazing. Do you know how hard it is to have a single key? Like how many hours I've wasted writing papers or trying to get stuff, you know, the experience you described, Harris, when you were on the inside, and we'll come to that. And then the other 50% would be like, why is it so hard? Like, why have you created such a solution? Because they'll be going, surely the NHS and any healthcare system has been calling out for innovation to help patient care get more efficient, you know, since day one. So why hasn't it happened yet? Actually, on that, like, why has it been so hard? So taking your entrepreneurial hats off and getting a little bit back to the problems, Harris, starting with you, what are the problems that the NHS faces to start there at adopting this sort of technology?
Well, I mean, what makes it hard is the context within which we're operating in. And it's, to be fair, it's not just an NHS problem. This is for most healthcare systems around the world. We're resource constrained. We have issues around recruiting and retaining talent when it comes to particularly digital and data and technology roles. And then you have a vendor ecosystem that's dominated by, you know, big incumbents in healthcare. Healthcare is one of those industries where there's not a lot of turnover. It's not like consumer app industries. There's not an Angry Birds or a Facebook that can suddenly like pop up and shock the world. And so that's and innovating that environment is very difficult, even if when you're the commissioner or the healthcare system. And when you're adding in experimental technology like AI, it's like, oh, it's another challenge or another risk on top of all the other sort of headaches I have. And that's what makes it difficult. That's not to say that it hasn't been progress. There's been lots of fantastic progress in the UK, in the NHS. You see headlines all the time of amazing stuff that's happening in AI and innovation. I think the key thing is for the health system and for us as well is how do you do that at scale so that every clinic, every department, every hospital is able to deliver that level of service. And that's what we're trying to achieve.
And actually, to balance that, Fazana, you've had great success with Hexarad. How's Hexarad now? 5-6 years?
Yeah, fully about 6 years, yeah.
So, and like, you know, it's not, a day doesn't go by that I don't open LinkedIn with another award or another thing coming up for you guys. So to balance the challenges, can you tell us a bit why innovation in healthcare is happening? What successes have you seen? You know, what's driving or putting the wind in the sails of Hexarad, as it were?
Yeah, I agree with Harris. I think there is so much innovation in healthcare, and innovation can take, you know, many different forms. But at its core, in healthcare, you're faced with an unstructured problem, generally, right? Whoever's working, there's an unstructured, unpredictable problem. And people are working really hard to try and solve that in the most efficient way in a resource-constrained environment. There's so much innovation, whether when you walk onto a ward or you're in an outpatient clinic or you're in a GP practice, you'll see everyone from an administrator to a clinician doing things and innovating. And so I think, like Harris, the challenge is scale. But I think, you know, even if you look at radiology, The UK adopted standards for the implementation of PACS, which is kind of how we look at images. Radiology is electronic; it uses voice dictation. That's something that's been around for well over a decade. When I was a junior doctor, we would have to get these like dusty films, So you'd have this big meeting and then you'd be running around the wards and finding a film. And that's changed now. Everything is electronic at the press of a button. So I think there's loads of really goodwill and some brilliant people working in the NHS. And I think it's also important for people to remember that, when people come up with a company or a startup, they sit around a table and they, think about an idea. That healthcare isn't given that privilege. In healthcare, things are being thrown at you a million miles an hour. Everything's being thrown at you, and it's literally life and death. So in the face of that, I think, the NHS has done a tremendous job with innovation.
AI is a massive buzzword. I mean, it has lots of promise. It has lots of potential pitfalls as well. What is it about Newton's tree that makes it unique?
Yeah, so we really understand what it takes to deploy AI at scale within an organization and across a health system, and so we solve a number of pain points across that journey. So if you think about where a hospital or healthcare system might start in their sort of AI journey, it would be around discovering products, trying to identify what they might be interested in. So we operate a vendor neutral marketplace, which means that we don't have any exclusivity with any particular application. And it means the healthcare system has the maximum flexibility in terms of what products it wants to try. We also do a lot of the vetting around whether these applications are approved and what evidence they have. And that allows hospitals to make slightly more informed decisions. But one of the problems that hospitals have today is that they have to make early decisions. So they're not quite sure which of these three products they want, but because it's so difficult to integrate and to stand up infrastructure to trial them, they'll pick one prematurely. But with our platform, you could deploy all of them and you could run them in sort of shadow mode. So it's running sort of experimentally and you're essentially trying these algorithms on your population and you're doing it in a safe way that's secure. So you're not impacting, clinical care unexpectedly. And then as you've built confidence in that application, generated evidence of performance locally, you can then start a procurement process and commit to one technology. And even once you've committed to that one technology, it's important that it still continues to deliver value. And so we continuously monitor the performance of these applications independent from the vendor to ensure that the healthcare system is getting the value that they signed up for. And that entire pathway, it's born from our experience of doing this from the inside.
Yeah, and those are the two words that people commonly come up with why we can't do this. One is procurement. So you're going to help with procurement. I get that now. What about governance? How are you going to help me with my governance team?
Yeah, so it's a part of the journey that's often overlooked, and it's really important to us. So I'm a trained clinical safety officer, and that's what part of my day job in the NHS is signing off the safety of a lot of these AI technologies. And one thing that we do for the ecosystem is we run courses to educate healthcare professionals in the NHS on how to properly risk assess these technologies. And going forwards, once they're using AI applications within our platform, we ensure that we surface data around performance, around drift in performance, that then feeds into those governance processes so that they can proactively manage these technologies to ensure that they continue to be safe and effective.
And Harris, AI platforms, there's a few that come to mind. Tell me a bit about what makes Newton's tree unique.
It makes me think of I'm paraphrasing a Steve Jobs quote, which he says something along the lines of, if you care enough about software, you'll care about hardware. And that's the same thing with Newton's tree, is that we care so much about how we can help healthcare through AI technology that we care about all of the dependencies that are involved around AI adoption. So a lot of the AI platforms, they'll only really focus on sort of the integration bit, as in the technical integration. They won't think about workflow, they won't think about clinical safety or evidence generation, and they won't think often beyond the silos of, say, image interpretation. When medicine, radiology is so much more than just image interpretation. And so in Newton's tree, we very purposefully try to solve the entire problem. From the very beginning, when you're trying to identify potential solutions on the market that might help your department or solve some need, through to piloting technologies and providing a safe sandbox for healthcare systems or healthcare providers to test these technologies on local systems using local populations, and then through the procurement process, and then once it comes to implementation, operationalization, we then help them monitor the performance of these technologies and weave it into their clinical governance processes to ensure that they're safe and effective. That's ultimately what makes us different to everybody else.
What is it you hope this partnership will be able to give back to caregivers? Is there something in your mind you're like, this would be great if we could just give people this so that they can get on? Harris, what would be amazing for you to be able to give back?
I mean, just generally, our mission at Newton's Tree is advancing the adoption of AI in the healthcare system. And we hope with it, it brings all of the promise that AI technology has in terms of automating mundane tasks, reducing risk and errors, helping practitioners practice at the top of their license. That's been a real challenge with healthcare staff in the NHS and more general. And I'm hoping by working together with the Hexarad team in delivering AI technology, but then also increasing the quality of AI evidence and AI apps in the market, it will lead to a system improvement.
Fazana, go on. What are you hoping for out of the partnership? What do you see? Like, give us something tangible that would be meaningful, that would come out of this collaboration.
I think time. So I think when I look at healthcare, the number one resource constraint is not money, it is time. And what we're hoping with this partnership is we actually free up time. So whether that's, starting with when we integrate with a hospital, making sure that an already stretched IT department doesn't have to do multiple integrations. They can do this integration and they can move on to whatever their next big priority is. It's making sure that, the people who work in a radiology department are doing absolutely the work that gives them the most value, not spending time on admin. It's making sure that patients aren't waiting around for their scans. They get their scans as soon as they possibly can so they can move on in that pathway. It's using some of the tools on Newton's Tree and using some of the research and the evidence we're going to generate to give time back to people so they're actually using the tools that are best suited for them. And I think if we can unlock that, we can unlock the world.
Yeah, brilliant. I love that. Like, the corporate world, time is money. But I think in healthcare, time is care, but not just for patients, also for caregivers. I mean, we're just seeing so many people that are overstretched and not knowing where to go. I think it is great. And the idea of just starting from that and being able to think about it from the beginning, like, who cares about IT departments normally? Like, but so vital to getting anything in. Who cares about the evaluation from the very beginning? So it's great. You've got to come together and show the way. Fazana, what do you think the timelines are? Is this something that we're going to see soon?
Yeah, you can see it right now. So if you're a hospital and you want to revolutionise how you do radiology, then get in touch.
Brilliant. And how would people go about finding out more?
So you can contact either Hexarad or Newton's Tree. Go onto our website. There's a contact form for both of us. And yeah, just drop us an email.
Okay, great. And then can I try it before I have to sort of sign up, or is there?
Yeah, well, I mean, that's part of the philosophy of the Newton's Tree platform, in that we support the entire buying process. And so what's really important is that you're able to pilot or to trial some of these technologies, so that you can understand how they work in your own workflow with your local population. And so the platform allows you to do that. And once you have the confidence through the evidence that's generated through OptiRad, for example, you can then procure and operationalize that platform or the application through the same platform.
Thank you so much for talking to me today. I'm really excited about what's going to come up next, and I can't wait to see the fruits of the labour from this collaboration.